Strep throat is a bacterial infection that mainly affects children and adolescents, but it is possible for anyone to catch it. You can get strep throat by coming in contact with secretions from an infected person's respiratory tract, such as when someone coughs or sneezes. Signs of strep throat include a very red throat that may have white patches, as well as fever, body aches and chills, pain when swallowing, and swollen lymph nodes in your neck. You can't identify strep throat based on its symptoms alone. A doctor will need to do a throat swab and order at least one test to make a definitive diagnosis. It's very important to see a doctor for diagnosis and treatment if you suspect you may have strep throat. Failure to do so may lead to a number of complications, some of which can cause lasting damage or even threaten your life. In this video, we share our top tips to cure strep throat. The main treatment for strep throat is a course of antibiotics. Your doctor will prescribe antibiotics only if you've been given a clear diagnosis of strep infection, which is confirmed by testing a throat swab. Most sore throats are caused by viruses, and there's no benefit to taking an antibiotic for a viral infection, although there are risks, including medication side effects and a greater potential for antibiotic resistance. In the future, according to Remedies, a pediatric infectious disease specialist at the Mayo Clinic in Rochester, Minnesota, penicillin and amoxicillin are the two standard antibiotic treatments for strep throat. Either option is taken by mouth for 10 days. In rare cases, when someone can't swallow effectively, injected penicillin may be used instead. Our next tip would be to take pain relievers. Over-the-counter pain relievers like ibuprofen, Advil, Motrin, and acetaminophen, Tylenol, may help relieve throat pain and reduce fever. Be careful when it comes to aspirin. It should never be given to children recovering from chickenpox or flu-like symptoms, since it can cause a rare but serious condition called Reye's syndrome. Our third tip would be to drink hot beverages. Warm drinks like tea can soothe your throat, especially if you add lemon and honey. Our fourth tip would be to suck on throat lozenges. Many throat lozenges have pain-relieving ingredients, and all of them can help soothe your throat by increasing the flow of saliva. Our fifth tip is to try gargling with salt water. Dissolve 1/2 of a teaspoon of salt in 1 cup warm water and gargle with this solution several times a day to see if it improves your symptoms. And our final tip is to use a humidifier. If your home or bedroom has dry air, using a humidifier or cool mist vaporizer may help soothe your throat. Note that if you have allergies, a humidifier may make your symptoms worse. Also, be sure to follow the manufacturer's instructions for cleaning out your humidifier regularly to avoid the buildup of mold and other particulate matter, which can make allergies worse. So that sums up our top tips for strep throat. If you found any of it useful, then hit that like button, and if you're new here, feel free to subscribe.